We have heard about the rise in COVID hospitalizations for children across parts of the country. Of course, as parents, we worry what we should do to keep our kids healthy and safe. So here in San Diego, how are things looking? We have Department Chief of Pediatrics at Sharp Chula Vista, Dr. Ahmad Bailony, joining us. Doctor, good morning. I'm so glad you're on with us.
Good morning. Thank you for having me.
You know, there's a lot of parents with a lot of questions. As we were talking during commercial break, you know that all too well, right? You're getting a lot of calls.
Oh, yeah. Yesterday, I mean, no exaggeration, in the office, I think every other phone call our receptionist got were about some form of COVID questions. So very busy times.
And, you know, I'm the mother of a toddler. We've talked about this repeatedly on our show, where little kids get sick all the time with runny noses, maybe fevers, ear infections, things like that. So what are parents now doing? I mean, every time, you know, our child has a runny nose, we're like, oh, let's do a nose swab and check for COVID. What should parents be doing with these young kids who are just constantly getting sick? They're getting the cold.
Yeah, I mean, you know, I think the advice is really very similar to whenever your kid gets sick. I mean, it's always like, how sick are they? So if your kid has symptoms of cough or congestion, but they don't seem like they have trouble breathing and they're taking fluids pretty well and still making like good urine output, generally you can watch them at home. I mean, obviously with COVID nowadays, you do want to test them for COVID. That also is going to require patience on everybody's part. Unfortunately, for example, in my life, if you include my medical school experience, I've been in the medical field around 17 years, and this new variant is, no exaggeration, the most contagious thing I've ever seen.
Wow.
So there's a lot of demand for testing right now. You may not necessarily be able to test exactly when you have symptoms, but if you can get a test in a couple of days and just, you know, monitor your kid at home for those things we just talked about, that's really what you should be doing.
Okay. And, you know, at the top of our newscast, even here, we were talking about the rising COVID cases among children. A lot of children nationally, looking at the big picture, are in hospitals. You know, it's kind of grown about 75% in the past month. So what are you seeing here in San Diego? Are numbers for kids going up?
I mean, San Diego has also seen an increase in hospitalizations. It's not just from COVID, it's the winter season. And I'm sure any parent knows that when your kid goes back to school, they invariably come back in a week or two with some form of snotty nose or cough. So we are seeing an increase in numbers. The early good news about the new variant is that we don't think it's more dangerous in kids, but given that it's more contagious, more kids are getting it. And so when more kids get it, you'll inevitably find, you know, some kids here and there that are going to get more sick from it. So it's this is a matter of all kind of taking care of each other.
Yeah. And with this Omicron variant too, I mean, are you seeing a lot of that locally, and how are children responding to Omicron? I mean, we've been talking about the symptoms being milder. Is that what you're seeing?
Yeah, I mean, I do think it is important still. You know, I think all of us as a society, we've been like living with COVID for 2 years now. And I often get a parent who, when their kid, you know, gets COVID, really stresses out and faces a lot of anxiety. And one thing to know is COVID is still a virus. So if your kid, you know, has COVID, but same kind of things, like they're not having trouble breathing, they're taking their fluids pretty well, and they're making good urine output, the best thing to do is still isolate your child, not expose them to anybody else, not get anyone else sick, and obviously contact your pediatrician for advice.
Okay. And, you know, for a lot of kids 5 and under, for example, under 5, you know, they're not able to obviously get the vaccine. So how should parents kind of address that? Is it good right now to keep them away from gathering with other family members because they're not vaccinated?
Yeah, I would say with the holidays and everything, that if you can avoid large gatherings, especially in those kids under 5 who can't get a vaccine, then, you know, that's best for their health. It's never really a good idea for your kid to get sick. And it's not fun on the family and the household, especially with how contagious COVID is. So, you know, it's really a lot of the lessons we've learned over the past 2 years. It's like you socially distance when you can, you try and mask, although with kids, you know, that are younger, that's a little difficult. And then always doing stuff that's more outdoors is more advisable than getting together indoors.
Yeah, still following what we've been trying to follow. Also, of course, the question about vaccines with kids, 5 and up. Some parents still are hesitating for the younger ones. They don't necessarily want to give them the vaccine. How have these younger kids, let's say between 5 and 11, been responding to the shot?
I mean, we've been giving the vaccine in my clinic for over a month now. All the kids, literally 100% of them that have come through the door have done just fine. In fact, a lot of them are excited to get it. I encourage parents to get it. I know it's a controversial subject, but honestly, a vaccine is the best way of protecting your kid's health. In the modern day, when we look at doing things organically, a vaccine has to be looked at as an organic process, because when you get a vaccine, the immunity doesn't come from some inorganic thing. It comes from your own body. And so your kid's body is, something, an immune system is something that's actually magical. And as a parent, you should be grateful that we have vaccines. Right. When I was a kid, honestly, I almost died of a vaccine preventable disease. And I was at Rady Children's for 3 weeks with meningitis. In my entire career as a doctor, I've never seen a case of that. And that's because nowadays there's a vaccine for that disease.
All right, saying it right there. Thank you so much, Doctor. We're out of time. I have so many more questions, but I'm sure plenty of parents will be asking you throughout your day today. Thank you very much for joining us.